Well, thank you for joining me for this interview today.
You are so welcome.
How did you find out your child has GSD?
When Kaylee was about 3, we noticed that she had a distended belly. And as she got older, that wasn't changing. Also, it was very interesting. Her pediatrician had done some blood work, and her cholesterol level came back extremely high. It was, I think, even into the 300s, which also was not necessarily normal for a 3 and 4 year old. At that point, the pediatrician recommended that we go to an endocrinologist. The endocrinologist evaluated and felt that we needed to see a geneticist. Through that time, I continued to do research myself online, and I would search keywords, high cholesterol and distended stomach or belly. Um, GSD actually came up a couple of times. And at that point, I realized that maybe that was something that I needed to ask the geneticist about. And he did agree to test Kaylee for that. At the time, he said that's not likely, but we will test for it. And lo and behold, it came back positive. So at that time, the test was only done at Duke University, and our insurance didn't cover it. It was an out of pocket test. I think it was like $500. Um, so as far as GSD, it is, and the diagnosis and the education that has taken place, it's amazing how far things have come.
What type was was I tested for?
Um,
What's the
GSD type 1A,
what's the treatment?
cornstarch every 4 hours, and now glycosade at night, and diet restrictions. No fruit, no milk, no table sugars.
How did you feel when you found out I found out that I had GSD?
Um, Mixed feelings. There was definitely a feeling of like relief because we had known that something was not right, but there was that sense of relief that we were finally beginning to receive some answers. At the same time, there was some grief and just dealing through the loss of um, a normal, healthy child instead of um, a child that wasn't going to encounter medical or health types of challenges. Now we knew that we were going to be facing a lifelong condition where there may be some challenges. So it was a struggle.
How did you overcome that feeling of grief?
But definitely grief is a process. So we would work, it took time. We worked through those feelings and then came to a point where acceptance was what was best,
Can you
obviously, for
tell an
our family.
example of how you overcame grief?
Um, we are a Christian family, and so I definitely relied on God to help me get through and accept my feelings.
Thank you for that. How did you tell your loved one that they had GSD?
I don't really remember because Kaylee was 4, between 3 and 4, maybe 4, when she was diagnosed. And at that time, there was really no support. There was no, I did not have access to other families that were encountering GSD. The doctors were literally there just to diagnose and treat. Um, and then they didn't give any other recommendations. Facebook was not a thing. Um, So as far as resources, we were very limited. So for the most part, communicating was, I just knew the treatment from the doctor, and we didn't really talk about it. We just treated Kaylee. And I don't know really at what point she started to realize that she had GSD and that that's what it was called. And that was the reason that she was having to live the lifestyle that we were guiding her through. So I don't know.
If you could go back in time, what is one thing related to me having GSD that you would have done differently?
I would have educated you sooner, right away. I don't know the route of education I would have taken. We may have even had to seen a counselor to help us through that, but I would have worked harder to seek outside help and making sure that we communicated with you in a healthy way so that you could understand that you were going to be okay, that this is something you were going to be dealing with, and that it was okay, that we loved you, that we accepted you, and that you may have some additional challenges, but it wasn't anything that we couldn't overcome.
What advice do you have for other parents as they support their own child with GSD?
Communicate, communicate, communicate. Um, help them to stay on their GSD diet when they struggle. Be there to encourage and help them through the challenges that they encounter.
What is something that's not currently offered in the GSD community that you would like to see available?
A cure. I know research has been a big part of the GSD community lately, especially in the past few years. So I guess if I were to seek out something, a cure would be great.
Is there anything else you would like to share today?
No, I love that Kaylee is taking the time to do this, and I'm excited that others will learn from what is being offered through these interviews. So thank you for doing this.
Thank you for your time again. You have a great rest of your day.
Thank you, you too.